Hello, Mr. Matthews. Hi, I'm Dr. McDonald. Nice to meet you. Before we start, can I just confirm the information I've been given about you is correct? So you're 30 years old,
Yes.
is that right? And you were diagnosed with Crohn's when you were 16.
Yeah.
And I understand recently you've been having some problems with abdominal pain.
Yeah.
Is that right? Tell me a bit more about that.
Well, it started about 2 months ago.
Right.
And it was a severe sort of cramping on my right side.
Right.
And it was on and off, but it seems to be getting worse. And recently I've had some episodes of vomiting and pain together. And I've also had a couple of times when it's just been so excruciating that it's left me in bed for a couple of days. Right. And I mean, this is a really busy time in my life, and I can't cope with it. It's awful.
Tell me more about the pain. How would you describe the pain? Is it sort of twisting, burning, stabbing pain? Or?
Yeah, I wouldn't say burning, but yeah, it's a real clenching pain, and it shoots through
so
me.
It's right down here on the right
yeah.
side. Does it go anywhere else or happen anywhere else?
No, so far it's only been on the right side, but yeah, the pain can sort of shoot across, but it's very specific to that side.
So, and how often does it happen? Every day, every other day?
Yeah, it's coming now when it's nearly every day.
Right. So, notice any pattern in terms of when you eat and when the pain comes on? Or?
Yes, certain foods irritate it, especially vegetables.
Right.
I mean, I'm still hungry, but I've been eating less just because I don't want the pain.
Right. Have you lost any weight as a result of that?
Or? Yeah, about half a stone so far.
In 2 months over the last?
Actually, it's been in the last month since it's getting more frequent.
Right. Tell me about the times when you vomited. How often has that happened? How many
That's
times?
only been twice, but it lasted a good 24 hours.
So the pain's lasted longer and you've started to be sick. Yeah. And what came up? Was it just sort of...
It was the food that I'd eaten.
Right.
And then eventually just, bile.
It just settled down.
Yeah.
Did you see your GP at the time, or...?
Yeah, and he referred me to you.
Oh, right, and that's how this was arranged. So it's been getting more frequent, and the episodes are lasting longer, is that right?
Or? Yeah, or I've just had a few episodes where it's been really, really bad and it's put me in bed.
Right. Have you had any problems with diarrhoea? Are you opening your bowels more frequently in between or during these episodes? Or?
I tend not, when I'm having them, I tend not to go to the toilet.
Right.
I haven't had any diarrhoea, but I have noticed that I have been going more often and slightly kind of looser stools.
Is there any blood in the stool or any mucus or anything like that?
No.
And after you open your bowels, does the pain go away or is it still there?
It tends to go away because I tend to go to the toilet when the pain's gone. I tend to relax.
Right, I see. Okay, so the pain goes away before you open your bowels rather than the other way around. Have you noticed any other symptoms at all? I mean, have you noticed any problems with your joints or achy pains in your joints and your knees or ankles or your lower back?
No, I haven't, not really. The only other thing that's different is I've been getting some mouth ulcers, which I don't normally get. I mean, it's never been a problem for me.
Do you remember getting those when you were diagnosed with Crohn's previously?
No, I don't, actually.
Right.
My eyes have been really dry as well and sort of gritty, which also is not something that I've ever suffered with before.
Right. Do you have any rashes or skin problems that you've noticed recently?
No.
Speaking of when you previously diagnosed with Crohn's, tell me what happened. I understand you underwent an operation in the end.
Yeah. Yes, I had a part of my small bowel removed. I can't quite remember what it's called. Okay. And I had a series of steroids, which I really didn't like.
Right. Why didn't you like them? Did you gain weight? Did it change your mood?
Yeah, it did. All of that. I gained weight, I got acne, and the effect on my mood was so bad that it took me years to get over it.
Right. How long did you actually take steroids for before?
It wasn't that long. It was a few months.
Okay. Before the operation or after it? Or?
Afterwards, I was on medication, I think.
Okay. All right. And how long since the operation was the medications just weaned down and stopped? Or?
Yeah, I've been off it for a long time. It was just in the initial months afterwards.
Do you take anything else apart from the steroids that you remember?
No.
Okay. And you've not been on anything since stopping those medications, or have you taken anything else?
No, I haven't. Since the operation, it was very successful, and I've been without any symptoms for a long time.
Right. So from your point of view, the operation sorted things out. And do you know how much of your small bowel they removed, or?
I don't know. I know. I was only 16 at the time and wasn't really
Okay.
paying much attention.
Sure. How are your waterworks? All right, you peeing okay? No stinging or burning? Or
No.
any problems with your breathing or
No.
chest pain, anything like that? Okay, so just dry, gritty eyes, and you've noticed lots of small mouth ulcers as well.
Yeah.
Apart from the Crohn's diagnosed when you're 16, have you had any other medical conditions in the past or operations for anything else?
No.
So you've been otherwise well until
Yeah.
recently. And have you taken any medication since this pain came on? Do you take any painkillers or anything like that?
No. Oh, I take some painkillers occasionally,
Right.
just, over the counter ones, but no.
Okay. Are you allergic to any medications at all?
No.
And apart from the mood disturbance and the weight gain, the steroids, do you have any other side effects? Or
No, apart from
not
acne.
that that's not enough, but
Yeah. No,
right.
yeah, I had acne, but I was a teenager anyway.
Sure.
But yeah, it made it worse.
You mentioned before about things being a very stressful time for you. What do you do for a living?
I'm a barrister. I'm about to do my bar exams.
Right. Okay. And when are your exams? Are they in the next few months? Or
Yeah,
weeks, or?
they're just after Christmas, so about
Right.
3 months.
So a stressful time.
Yeah.
And if you had time off work because of this problem, you mentioned you couldn't go to work one day, at least one day when it started.
Yeah, about twice or possibly 3 times I was just in such pain that I couldn't get out of bed.
And have your work been quite understanding about it?
Yes, because I am allowed to have study days, but of course it's not convenient. I have so much work to do.
Right.
So yeah, it does disrupt my life, and especially with my, exams at the moment, I need to be actively studying.
Sure. Do you smoke at the moment?
I do, I'm afraid. About 10 a day.
Right. And has anyone ever discussed smoking and Crohn's disease with you before? Or?
They have, but I find it very difficult to give up.
Sure. And for a long time you were quite well between your last operation.
It hasn't been a problem.
Have you ever been referred to a smoking cessation clinic by your GP, or tried patches or chewing gum at all?
Well,
Any
kind of, you know what it's
techniques?
like in the new year, you try and give up and never really do.
Right.
Well, I do, so, but I've never been to one of the clinics, no.
Okay. Do you drink much alcohol at all? Or
Not much, just the occasional glass at weekends.
do you have at least 3 or 4 days a week when you don't drink at all, would you say?
Yes.
And tell me about your family background. Is there anyone else in your family who suffered with problems with their bowels, Crohn's disease or another condition similar to Crohn's?
My father always, through my childhood, had problems with his bowels, and
Right.
he died of cancer. It was
Was that cancer of the bowel? Or
it was
cancer of
it's colon rectal, I think
Right.
it was, that eventually he died from.
Yeah.
In his early 60s.
Right. Okay. Do you recall when you were diagnosed with Crohn's ever being told that the large bowel was affected anyway, or was it just the small bowel that they removed? Or?
I was told that it was just the small bowel.
Right.
I wasn't told whether anything else was affected, but that was what their main concern was at the time.
Okay. So just to summarise, your problem's been really going on for 2 months, and you've been having worsening pain down on the right side, the right lower part of your abdomen, which is cramping, and it comes on initially for a few hours, but is now more persistent and more frequent, and on at least 2 occasions associated with vomiting.
Yeah.
And you've lost weight, your eyes are a bit dry and gritty, and you've noticed you've got some mouth ulcers as well. Is there anything else you think I've missed that you think's important, or any other symptoms we've not talked about?
No, I don't think so.
Okay. Well, thanks very much for
Thank
talking
you.
today. Thanks. So in the history-taking scenarios, the examiners are looking for the ability of the candidate to form a problem list, just as they would do as a registrar in clinic or on an acute take on call. Usually number one in the problem list is the diagnosis, and this might be obvious. In this case, it's quite clear that this patient has had Crohn's in the past and they've had an episode of abdominal pain after a long period of being symptom-free. And Crohn's has to be number one on the differential diagnosis. But of course the diagnosis is quite nuanced. It could be an anastomotic stricture from slow indolent fibrosis at that site, or it could be new inflammation. And there are things in the history to point you in one direction or the other. The presence of dry, gritty eyes might suggest a uveitis. Ulcers might suggest active Crohn's disease, which is more a hint towards inflammation than it is towards fibrous scar tissue causing a surgical blockage. And that's something that the examiners would expect you to discuss and explore. There are also other differential diagnoses to consider. This could just be stress-induced irritable bowel syndrome, although that's less likely. And with the family history of colorectal cancer, one has to think about malignancy being a possibility. A colonoscopy might well be a sensible investigation, although she's very young and this is an unlikely possibility on the whole. The other key things in the problem lists will have to take into account other important factors of the history, and the fact that she's still smoking with Crohn's disease is a crucial one. So control of Crohn's disease in a smoker is typically very difficult indeed, and one would have to say to the examiners that you would aggressively pursue a course of action to help her stop smoking, including referral to a proper smoking cessation clinic. She also mentioned that she's very busy and working to sit her bar exams. It's obviously a very stressful time, and having had an operation before which sorted things out and not being very keen on taking steroids again, for which she had a number of side effects, then it's worth mentioning to the examiners that you anticipate negotiations over therapy and compliance might be an issue. Obviously she needs to have a series of investigations before you can make a management plan, but it's worth bringing up at an early stage the possibility that there will need to be lots of discussions with the patient and perhaps with a specialist nurse about the future options. One more important point is to make sure that the extraintestinal manifestations of Crohn's, such as uveitis and joint pain, skin rashes, have been excluded by questioning. And if a patient mentions they have sore, gritty eyes, you should mention that you do some investigations to exclude other causes.